The City of New Bedford recently announced 2 Southeastern Massachusetts regional care centers for those recovering from COVID-19. These care centers are located in former nursing homes at 1123 Rockdale Avenue and 4586 Acushnet Avenue and are essential in minimizing the burden that the virus is putting on the local healthcare system.
There's no hospital in America, no health department, no elected official in America that frankly could have anticipated what is in effect a once-in-a-century pandemic, and it's happening at the speed of the 21st century.
After the City of New Bedford identified these 2 sites as updated medical centers that were ideal for housing patients, Southcoast Health agreed to partner as the medical lead for the care centers.
With the great collaboration of Southcoast, with Keith really taking the bull by the horns in a way that was absolutely necessary, we were able to start to figure out how to put these facilities into condition to be ready for a large number of patients.
So throughout this pandemic, Southcoast Health's pledge to the communities that we serve is that we will do everything we can in our power to protect our patients and, most importantly, our courageous staff who are serving on the front lines. So this partnership really represents a proactive step in those efforts, and we're grateful to have worked so closely with Mayors Mitchell and Coogan, the town of Wareham and other municipalities, Frank Romano, the owner of the Essex Group, who is a true hero in all this. As John was saying, Frank stood up when other people stood by.
Generally speaking, to bring systems in a vacant building up online, I generally would say it would be about 90 days to kind of work through the process. We pretty much got the building up on its feet in about 2 weeks. It's been amazing. Certainly we shortened the procurement process because under the emergency order, we're able to do emergency procurement, which means we don't have to put things out to bid and have that time lag. We were able to work with vendors that we're familiar with, and bring them in. They've all been very responsive. There were probably 10 or 12 of them all told. And they've been all great to work with. They've chipped in. Some have discounted their services. Some have done extra services at no additional charge as we uncover things that still need to be fixed in the building. So they've been great to work with. City departments, our department, Commissioner Pont at DPI doing all the landscaping work and the outside work to kind of lighten the load. In that response, we had our staff carpenters here and our grounds crew here as well, doing some work on the interior of the building and moving things around. It feels great, I've been with the city for almost 6 years now, and when I worked in the private sector, this was the type of work that I did in large commercial buildings, system replacements and upgrades. So I had some familiarity with the process of what had to happen. The challenge was the compressed timeline, but my team rose to the occasion. Anything that I needed my superintendents to help us with, they snapped right to it, and we couldn't have done it without a great team, and that's how it worked out.
Mark Champagne's crew, again, about whom I can't say enough, really figured out how to open this place back up, and it ran the gamut from reestablishing the heating systems, the plumbing systems, recertifying the elevators, doing a deep sanitation of the entire place, reconstituting the security system, even landscaping. And there are good reasons for that as well as adding equipment, moving old equipment out, furnishing the place, a whole lot of stuff over really starting 3 weeks ago and continuing on through today.
The goal of these care centers is to provide medical care for the less severely ill COVID-19 patients as they leave the hospital, so that St. Luke's and other Southcoast Health hospitals can focus on those needing acute or intensive care. The care centers don't take walk-in patients or provide testing. Patients are admitted to the care centers based on the recommendations of a physician at one of Southcoast's hospitals. The care center's clinical teams will evaluate the patients and tailor a care plan specific to their needs. Clinical teams consist of registered nurses, licensed practical nurses, and certified nursing assistants, with medical supervision provided by physicians from the Southcoast Health System. Much like the hospital, visitors will not be allowed to protect the staff and patients.
This has been a Herculean effort to stand up a 100% COVID-19 facility in a normally impossible time frame. Without the help of the governor's staff, the mayor of New Bedford and his staff, Massachusetts Department of Public Health, and the staff of Southcoast Hospitals, none of this would have been possible.
Thank you to you, the general public. Thank you for staying at home. Thank you for practicing good hand hygiene. Thank you for going to southcoast.org periodically to get information about COVID-19 to keep you and your families healthy. And thank you most importantly to our frontline physicians, providers, nurses, clinicians, clinical staff in our hospitals, our urgent care centers, our practices, and now in our regional recovery centers.
This facility will make a big difference. It is not the only facility. As I said, there's another one up on Acushnet Avenue together. They will have about 230 beds to help decompress the hospital system. We're not done yet. There may be more facilities that we have to put online, but this is a big relief that we have these things in place in order to allow our health system to treat the most acutely ill among us.
We're glad to be a part of this and glad we're able to be successful and get the facility up and running. And second facility to be live, I believe, in 2 weeks. So we're going to work hard on that one and get that one in the same shape this one's in, and hopefully we won't need all the beds.
The city is committed to keeping all our residents safe and encourage you to continue practicing social distancing and good hygiene. For more information on the city's response and preparations for COVID-19, visit newbedford-ma.gov.